This April, one hospital vial turned Putin's cancer promise into a patient, because the strange part is that this is not prevention. It went to a 60-year-old with advanced melanoma already inside the body. So if you hear the phrase cancer vaccine, pause right there, because this version begins after doctors know the enemy's face, and before that sample exists, treatment is usually less personal. A melanoma cell can look too much like the person carrying it, meaning the immune system needs a clue that belongs only there, so the first job is not injecting anything, it is reading. That reading searches for neoantigens, mutated protein flags on those cells, and once you see that flag, the whole idea changes. Because the vaccine is no longer for cancer in general, it is built around one person's tumor map, and that is slower, but it is also why the claim is worth testing carefully. Now, the cascade starts with code from the tumor itself, where software compares the tumor with the body's normal pattern, because the target must be dangerous without confusing healthy tissue. Here is the clever part. Doctors are not injecting the flag, they write an mRNA instruction that teaches cells to display it, meaning the body gets a rehearsal before the real fight continues, and that rehearsal needs a delivery truck small enough for cells. Those tiny fat bubbles are lipid nanoparticles, a familiar vaccine delivery idea. The same broad method made COVID shots scalable, but the goal differs. This is not meant to replace surgery, drugs, or immune therapy. It is designed to work beside them, like a more specific alarm. And listen, that specificity is also the bottleneck nobody can skip, because every new patient means another sample, another sequence, another design, so the breakthrough, if real, lives inside a difficult workflow. That is where the evidence gets uncomfortable, because announcements outran proof. Most public details came through Russian state channels, not independent journals, and that matters because medicine does not run on press confidence. Animal results can look dramatic, while human results remain unresolved, so the honest words is promising, not proven. That difference sounds small, but for patients, it is everything, because hope can help people endure, and hype can mislead them. There is also no approval outside Russia attached to this name, which means you should not hear it as a finished global treatment. But now imagine being the person whose tumor becomes the blueprint. The lab is not studying cancer somewhere else. It is studying yours. That can feel like precision, and it can feel like pressure, because every delay in the workflow is also time in a hospital chair. And that is why independent testing decides whether this becomes medicine. The name attached to this step is Neooncovac, but the real twist is that its name matters less than its recipe, because the recipe is copied from the patient, then sent back altered, which is almost the opposite of how most people picture vaccines. You are not training a crowd before disease appears, you are trying to help one immune system recognize one enemy, and that enemy may change as the tumor changes too. So the future here is not one magic shot, it is a chain of tests proving the chain can work, across labs that do not share the same political microphone. If that happens, cancer care starts looking less like categories and more like a case file written by the disease itself, which brings us back to that first vial in the room, not a cure, but a question medicine now has to answer.